Okay, hi everyone. So now we are going to look at into the performance toxicology. So before this, we have looked into the post-mortem toxicology. So this is the continuation of this chapter where we are going to look at performance toxicology. Okay, performance toxicology is often known as behavioral toxicology, where we study the influence of the drugs, influence of the drugs onto the behavior of the human or animal. Okay, so this aspect is commonly associated with drug of abuse in sports, which is where we call it doping, and associated with the performance deficits, which is in terms of drug facilitated sexual assault, in terms of impaired driving, and also other criminal acts while under the influence of the drug. Okay. Now we are going to look at one of the case in terms of performance toxicology where Lance Armstrong has been said to use banned substances including the blood booster, which is in this case erythropoietin and steroids in blood transfusion back in 1996. Okay, so there is a news stating that Lance Armstrong stated that you need drugs to win the Tour de France. Okay, so based on this, we are going to look at into the use of uh, abuse in sport, which is doping. Okay, so steroids. Okay, the steroids has been used way before in medical applications, but for some reason that maybe the use of steroids are going to be to affect your performance. Okay, sometimes it's going to make your performance much more heightened than any normal people. Okay, so that's why in doping analysis, steroids has been listed as one of the drugs of abuse. Okay, so the effects of steroid, they are listed in this figure. You can have a look at it. Okay, it is more towards the bad side effects of steroid rather than the good effects. All right. Okay, now we are going to look at doping. Okay, the World Anti-Doping Code provides a legal definition of doping. Okay, violations under the code would cover aspects such as the presence of prohibited substances or its metabolite or its marker in the athlete's specimen. Okay, so now you are going to look at what in terms of doping, it not just meant the presence of the drugs of abuse, but its metabolite also would cause a positive outcome, and also its marker also would provide a positive outcome. Okay, refusing to provide a sample or evading sample collection, tampering or attempting to tamper with any aspect of doping control, and lastly, the possession or trafficking of prohibited substances. So all of this has been provided by the World Anti-Doping Code. Okay, so doping, this is just for you to have a read. Okay, so we are going to look at into the list. Okay, there are lots of substances and methods prohibited by various human sport bodies. Okay, you have stimulants, you have narcotics. Okay, so you have exogenous anabolic agents. Okay, so you can have a read at this. Okay. This table also is provided the World Anti-Doping Agency code, the summary of urinary concentration above which WADA accredited laboratories must report findings for specific substances. Okay, so for urine sample, these are the threshold that needs to be reported if the specimen have exceed this threshold lah. Okay, all right. So doping. So what are the samples that has been required by doping? There are two matrices specified for testing, which are urine and blood. Okay, so you need to remember urine and blood is going to be useful for is the two of the most useful specimen for doping, urine and blood, and urine and blood, the collected specimen of urine and blood is going to be divided into two, which is sample A and sample B. there is a reason for why it is called sample A and why it is called sample B. We will look at after this, right? So urine is the primary matrix used for testing. So if you have a choice of having urine or blood, then you would choose urine first, and then if there are some special cases that you would need to have to use blood. But initially, the primary matrix, the primary specimen is going to be urine. Why urine? Because urine is considerably less invasive. Okay, it offers relatively low health and safety risks in terms of sampling and analysis. Okay, because for blood you need to use a needle. So urine is usually low health and safety risk, like having a low risk. Plus, the majority of the validated methods have been validated for urine as a matrix. Okay. Blood may be sampled, okay, blood may be sampled and used instead of urine, provided we have a validated method of analysis. Blood is used as a test matrix when detecting blood transfusion. If you have a blood transfusion prior to the competition and you are subjected to doping analysis, so usually we will have a blood sample, okay, because we don't know what the blood transfusion that you've got beforehand, what are the components inside the blood, whether they have drugs of abuse or not. Okay. Certain drugs that are not excreted in urine in detectable quantities, such as uh, re- reserpine or human growth hormone, can be detected in blood. Okay, as we have learned before, urine is just for qualitative analysis. Okay, qualitative analysis, so we can just detect whether there are some that there are if there is a presence of the drugs of abuse. Okay, so the International Amateur Athletic Federation always provide a second portion for defense use, which we refer as the B sample. Okay. After the first sample, which is referred to the A sample, has been found to contain the banned drug, okay, then you would open the B sample to check it again. All right. So after the competitor has been notified and invited to a second analysis with his or her own expert if the competitor wishes so. All right. So the B sample must be performed in the same lab as the A has been performed. Okay, so now you imagine that, okay, we have tested the A, okay, and the A have become positive. So now you would need to open the B bottle, and do the testing by the presence of the expert of his or her choosing lah. Okay, so the B sample must be analyzed as the same lab as you analyze A, but a different analyst must perform for the B. Okay, we want to maintain the environment of analysis, which is in the same lab, using the same instrument, using the same chemicals, but the analyst needs to be changed because we don't know whether the analyst's fault that make the A become positive. All right. Okay, so that is for doping. Now we are going to look at drug facilitated sexual assault. Okay, sexual assault perpetrated only mainly women but also in men, but some cases they are also being done on men while they are incapacitated by so-called date rape drugs, which recently became the focus of many investigations in many countries. Okay, during the past decade, a marked increase in reports of this crime as well as in number of scientific publications on the subject has been observed. So the use of date rape drugs has been increased over the years. Okay. So the list of the drugs, which is in this case flunitrate with other benzos, okay, such as diazepam, temazepam, as well as gamma, hydroxybutyrate, GHB, ketamine, and scopolamine. Right. So basically, these are the examples of the drug facilitated sexual assault. Okay. In a typical scenario, Okay, in a typical scenario, you would see this in the movies, can? You would see this in the movies that the potential sexual offender would spike the drink of an unsuspecting person with a sedative drug for the purpose of drugging them and subsequently sexually assaulting the victim while the victim is under the influence of substance. Okay, you would imagine that you have met, for example, inside the movie kan, you would see that, okay, these two person, man and woman, are at the club. Okay, so the woman would go to the toilet and then the man would, usually in the movie kan, so the man would spike the drink of the woman and then the woman come back and drink the drink, and then the woman will become like dizzy, and then the guy would take the woman home and perform the sexually assault the woman lah, the victim in this case, right? So that is the story. Okay, so the woman is apa, is under the influence of the substance. She does not know what has happened to her. Okay, victims usually report loss of memory during and after the incidents. They wake up in unfamiliar places, inappropriately dressed, and often with the sense that, but not the actual recollection of having a bad sex. Okay, all right. Drug facilitated sexual assault may also include situation where the victim is sexually assaulted after voluntary use of drugs and alcohol. Okay, so for some reason that the drug may have been voluntarily used. Okay, so she might claim that, okay, I've just taken the drug, but he did rape me under the influence. Okay, he did rape me while I am under the influence. Okay, so there is some evidence to that some did rape drugs may have been used recreationally, and that sexual assault can occur while the person is under the influence. Okay, these cases are also drug facilitated sexual assaults, even though the drug may have not been administered may have been administered voluntarily by the victim. Okay, so there is also this side of the story where the drug has been used voluntarily, but while she is under the influence, the guy would take advantage on her. So it does not matter whether the victim was given the drugs unknowingly or knowingly. The crucial aspect is that the sexual act is non-consensual, because in both cases, whether it is voluntarily or non-voluntarily, during that apa during that sexual assault, it is non-consensual. Okay, dia tidak ada permission daripada lelaki itu, tidak ada permission daripada perempuan itu untuk berbuat apa-apa, because the perempuan is under the influence. Okay, it doesn't matter if it is a voluntarily or non-voluntarily, but the act itself, the sexual act, is non-consensual. So it is still under drug facilitated sexual assault. Okay. Since some of the compounds, okay, are typically used in a single low dose, and the victim do not report the incident until sometime after the event, which is owing to amnesia. So after a few days that he or she had been sexually assaulted under the influence, maybe he or she would suddenly remember that he or she has been sexually assaulted. So sufficient time may have elapsed for most, if not all, of the drug to have been metabolized and eliminated from the usual matrices sampled for toxicological testing, in this case blood or urine. Okay, so these are one of the issues lah. Okay, one of the issues where you suddenly, after a few days of being assaulted, you suddenly remember that you have been assaulted. But when you go to report it and they have collected your blood or your urine for sometimes, because there are some time has been elapsed, can, 1 or 2 days, maybe the drug has been metabolized and excreted from your body. Okay, so this is one of the complicating issues lah. Okay. It would not be unusual for a urine or blood analysis to provide a negative result when the drug has in fact been ingested, because of the likelihood of a single low dose urine volume and length of time since the drug has been taken. So many drugs are deposited in hair, and hence it may be possible for detect the drugs in the hair after the drug facilitated sexual assault. Enzymatic hydrolysis followed by extraction of benzoes, including flunitrazepam, is frequently performed in order to increase the sensitivity of the assay. So this is also the continuity of the complicating issues. So as I mentioned, that sometimes after there are sometimes has been elapsed from the sexual assault, uh, when you are trying to detect in blood or urine, they might come back negative. Okay, but these drugs has been deposited into your hair. Okay, so you may be able to detect this by getting a hair samples, but the sensitivity of the analysis needs to be heightened because the concentration of the drug now is at a very trace level. Okay. Alright, some metabolites is produced endogenously in the body. Because of this endogenous production, it has been proposed that exogenous sources such as GHB should only be considered when levels in blood and urine exceed 5 and 10 microgram per milliliter respectively. Okay, so gamma butyrolactone is hydrolyzed to GHB, particularly at high pH, and hence if an analysis is carried out to differentiate between GBL and GHB, attention must be paid to minimizing hydrolysis. So this is an example as well, continuity of the complicating issues we have looked at before. Okay, so impaired driving. So now we have looked into the doping, drug facilitated sexual assault. Now we are going to look at impaired driving and the effect of alcohol. Okay, ethanol, which is a type of alcohol, is a central nervous system depressant, a CNS depressant. Okay, alcohol causes a slowing of nerve conduction, results in slower reaction times, difficulty in processing and integrating information, hence consequently diminish the performance with the undivided attention or task. All right. So drug or alcohol can be used and can affect the execution of any individual task, and their effects and therefore are more pronounced and more complex tasks such as driving. So driving, you would require, when you are driving, you would require an attention, attention towards the road and attention towards your surrounding as well. So this kind of individual task might be too hard for something as for some person that is under the influence of alcohol. Okay, so driving is a complex process where it requires a simultaneous integration between your psychomotor tasks, high-end coordination, muscle control, and cognitive tasks. So, by the use of alcohol, where it is known as the central nervous system depressant, then it's going to be a problem. Okay, all right. Impaired driving. This is something that you can read on. I want to go to the yep. Okay, blood alcohol concentration factors. Okay, blood alcohol concentration is a mathematical ratio of the percentage of the alcohol in the bloodstream. Okay, blood alcohol concentration refers to the percent of alcohol in a person bloodstream. Okay. Okay, a blood alcohol concentration of 0.1% means that 1 part alcohol for every 1,000 part blood. Okay, what does it mean? If it is much more clearer, it is 0.1 gram in a 100 milliliter blood. Okay, what are the factors affecting the blood alcohol concentration, which is in this case our weight, which is the blood volume, time spent drinking, gender, food, and the alcohol content, and the size of the drink. Okay. Uh, blood alcohol concentration levels that negatively affects driving behaviors. Okay, so there are there is the chart here. Okay, so there is a chart here where if it is a 0.01, then if keep on increasing, and usually at 0.15, it is 380 times more likely to be involved in a fatal accident. Okay, so this is apa orang kata tu, the chart lah. Okay, it becomes from 0.01 up until 0.15. Alright, so it goes without saying lah, if the alcohol concentration is much more higher, then it is much more higher risk, okay, towards a fatal accident. Okay, alcohol is readily absorbed through the gastrointestinal tract because you ingest the alcohol orally. Okay, in particular through the small intestine lah, with virtually 100% of oral dose is absorbed by a healthy person. Alcohol is a volatile compound kan, so being volatile, alcohol can diffuse into free air and hence can pass from the pulmonary system into the lungs where it is expelled in breath. Okay, the excretion of alcohol in breath makes breath alcohol testing possible. So the alcohol, you imagine that the alcohol, if it's ingested orally, it goes into your stomach, into your gastric juices, and it will flow into your small intestine for absorption. So the alcohol now is in your blood. But being a volatile substances, when it goes back to the lungs for the carbon dioxide to be expelled, alcohol also would be able to evaporate, not evaporate lah, to move with the carbon dioxide outside of your lung. Okay, so that's why breathalyzer is possible, so you'll be able to detect the alcohol concentration based on your breath. Okay, so the presence of food in the stomach can slow the absorption of ethanol. So that's why I think that sometimes in the movies, they would have something to eat first, then you would have the alcohol. Okay, because the alcohol absorption can be minimized with the food inside your stomach. All right. So this is a typical of blood alcohol concentration curves. Okay, so on you would see that on an empty stomach, the BAC curve instantaneously increase. Okay, while if it is after meal, or for example after a meal of potatoes, the alcohol concentration has been minimized lah. Alright, so the alcohol absorption is influenced by the time of consumption and the type of alcohol, and also the presence of food in the stomach. Okay, alcohol intoxication is influenced by the amount, the concentration of the alcohol, the time of the consumption, its body weight, and the rate of absorption. Okay, so this is what one standard drink looks like. Okay, so for example, if you have a beer, so you have a 5% alcohol for 20 ounce. Okay, which one is the most highest alcohol concentration is about 40% here, which is the brandy and the spirits. Okay, so a standard drink contains 40 grams of pure alcohol. Okay, so usually a moderate drinking is up to 1 drink per day for women and up to 2 drinks per day for men. That is the standard one drink should looks like. Alright? Okay. So this is the effects of alcohol on psychomotor and cognitive skills. So for example, if the blood alcohol concentration is about 4.5 plus, then it will cause death. Okay, this is alcohol intoxication. But usually if it is usually if it is 1.8 to 3.0, then it will cause confusion. disorientation, mental confusion, and dizziness. All right, so this is something that you can have a look at it to have some idea on what are the clinical signs and symptoms when we have increased in alcohol concentration. Okay. So to get in perspective, what are the theoretical lethal dose for a person? So for water, it says that 6 liter of water is a little dose. Okay, so for coffee is about 118 cups. For alcohol is about 13 shots only. 13 shots, you would have a 4.5%, 4.5 gram per liter of alcohol inside your body, then it will cause death. Okay, for wheat is about 1,500 pounds. Okay, so impaired driving test. How are we going to determine whether the person is is under the influence of alcohol or not when he or she is been driving. So they can be done via 3 tests, which is the breath test, field sobriety test, and blood test. All right. So breathalyzer. This is what I mentioned before. There you can use breathalyzer due to the volatile properties of alcohol. Okay, so the breathalyzer is, as in essence, measures the alcohol concentration present in 1/40 of a milliliter of blood. Okay, horizontal for field sobriety test, you would have horizontal gaze nystagmus, involuntarily eye jerk as eye moves horizontally, walk and turn, undivided task attention, one leg stand. So I think that you would have more understanding by reading this with the nystagmus test, walk and turn test, and the balance test. So this is important, okay, for you to be able as a forensic toxicologist to be able to know the test that has been done on the person while driving under the influence. Right? This is important, yeah? Okay. So, besides alcohol, several drugs also would cause impaired driving, which cause similar conditions. So, these drugs includes cannabis, cocaine, okay, MDMA, ketamines, opioids, okay. So, all of these drugs also would we can be able to use these types of tests, okay, in terms of whether we want to see whether their driving has been impaired or not. Okay. All right, so I will stop here first.